Hey guys, this is Mama C with CHD Connects Hearts, and together with Jessica Gibeau and Chris Gibeau and their beautiful mama, Victoria. Hello. So they are at Vanderbilt Hospital, and Jessica is in the hospital waiting for a heart transplant. They're from Houston, Texas, and they have been married for 25 years. She had 4 open heart surgeries. Is that correct, Jessica? 4 open heart surgeries, lots of cats.
Oh, yes.
Lots of cats. And now they are in Vanderbilt in Nashville, Tennessee, waiting for a heart transplant. They also have 3 adopted children that they've had. They are 10, 11, and 12. We got that right?
You got it right.
All right. So, Jessica, can you tell me your diagnosis from when you were born, please?
Tricuspid atresia with a VSD.
You say one more time?
Tricuspid atresia with a VSD.
Okay. And you said you had your first open heart surgery. You had the VT shut at 3 months.
Yes.
Yeah. So, Victoria, can you tell us a little bit, what was that like for you? Because I understood that you didn't know about it for about a week.
Yeah, that is true. I was getting ready to come home from the hospital. I had a cesarean section because she was in trouble. And I had a cesarean section, and then my mom was a nurse prior to, like a baby nurse, and she kept saying babies are supposed to be toasty and warm and she's cold. And a nurse practitioner found it, not the doctors. The nurse practitioner actually found it. And then I had my clothes on ready to go home with her when I had to get back in, and they did testing, and they said it would be something they could not help me with at all. It would be something correctable or something in between, like repairable. And when she came out, she had the tricuspid atresia with the ventricle septal defect, and it was repairable, not correctable or not the other way.
So this was 41 years ago.
Oh, yeah.
So
long time ago in Kaiser, San Francisco.
And at that stage, this was still pretty new. The font
very
new.
Very, very new.
And so it was at that time, was it considered experimental?
No, not experimental, I'd say. She had a Dr. Tarnoff with Kaiser, and who worked with UCSF, Dr. Turley and Dr. Ebert. I'm trying to remember. And she had, when they went to go put the shunt in, I'm sitting in the cafeteria and hear like code blue, and it was her.
No.
She had like a cardiac arrest, and that one was, she was teeny then. So she was in the hospital for a while there, and then got to come home. But it was really scary for me because not knowing anything about, I joined, which I don't even know if they still have anymore, a heart disease group there. A person called Liz Tong at UCSF started one, and they had a lot of mothers with children with heart defect there, where she started up a group on, which was really nice because we were all in the same boat.
Yes.
Yeah.
I think that's extremely important. The support network is extremely important.
Oh, yes, absolutely. And I was very lucky. When she was little, I had my mom and dad, and my dad was a huge help, and kind of got us through.
That's amazing. Yeah. So, how did let me say, Jessica said that you treated her like any other kid.
Mm-hmm.
And that back in those days, they did have the restrictions of, they didn't want them exercising.
Oh, yeah. That was really hard because she wanted to exercise. She wanted to run. And I was more on the cautious side, but try to keep her as normal as I could, for all this. And she was really small for her age, but we were really lucky that she hit 5 feet, which is good for a heart disease patient.
Yeah. So how did you deal with that? Because, one of the things I'm noticing is there's a lot of trauma associated with their
Oh,
parents.
yes.
It's like she said, she doesn't remember. She said she barely remembers the surgery at 10.
Right.
So how did you handle the trauma of all of that for yourself?
It helped, like the heart group helped, my support system, my dad really, really helped. And I just knew she was meant to be here. Just knew it, through everything. When she was little, she went through everything she had, I think I had heard, she got a cold and she had a stroke and went blind, and she came back from it, and just like went through everything really early on. And then she kind of there was many good years for her where she didn't have any trouble at all. The other thing that I'm really happy about is they kept telling me normally when she had her surgery at 10, people had the pacemaker put in, and I'm so happy she didn't, that she did well without it, since she's having so much trouble with the pacemaker now. So that was something that on hindsight I found out later. They asked why she didn't have a pacemaker, and it just wasn't one that came up then.
So how are you handling this situation? How are you doing?
Oh, it's hard. It brings back, like you said, the trauma of it, but she needs it, she wants it, and it's gonna be better.
Yes.
That she really, really wants it, and I know that, and that helps.
It does. I'm sure it does. So now, how far away from you are you from Vandy?
About an hour and a half.
Oh, that's not bad. Okay.
No, not too bad. We're about an hour and a half from it, and this just ended up just working when she was looking at different hospitals and stuff, and Vanderbilt's way up there and stuff. It just worked really good. I'm retired now, thank goodness, and Chris has taken care of the kids and work, so I stay here with her. It's really worked out good, where like when she was little, I had to work. It was me, because my ex-husband we won't even go into that, her dad and stuff, but it was just really basically me, and I had to work, and I was very lucky and had a very good boss that gave me Tuesdays and Thursdays off besides the weekends. And then
for your appointments.
For my employment, that was a big thing, because people still have to, they still have to work no matter how much you don't want to.
That's true. And my daughter's going through that, my grandson's 4, and the appointments.
Oh, yeah.
It's just the appointments.
Exactly.
And she tries to keep appointments on Tuesdays and Thursdays. As soon as you said it, I went, that's appointment days. I know what that is. Yep.
I was very lucky. Any other boss would have fired me, but I had a really, really good boss that really worked with me.
I got to ask you.
Okay.
That's your baby girl right there.
Yep.
Now, is that your only child?
Yes, it is. I did not even, after what she was going through, I couldn't take it. Something was wrong with another one.
I can understand that.
Yeah.
But you've got your little baby girl right there now.
Yes, I do.
And and they know now that they have kids. It doesn't matter how old they get, they're still our babies.
Yes, absolutely.
It just doesn't change.
It doesn't change whatsoever.
How elated have you been with her husband, Chris?
Oh, I can't even. I can't even. He is perfect. I couldn't have asked for anything more. I am telling you, if you want to see the perfect human being for taking care of your child, it is Chris. And their kids too. I mean,
I believe it.
I can't believe it.
This brief little moment that, this little bit of time I spent talking to him, I'm going, oh my gosh,
you just couldn't believe it. I'm just telling you, everything that goes on with her, he's right there. He has forethought, which I don't have. He has forethought and says, well, maybe we could do it this way. He knows all the right questions to ask, everything. Oh, we'd be lost. We would absolutely be lost. You couldn't ask for anyone better.
Yeah, I bet that'd just be so amazing, because I know, as a mom, when you're raising your babies, and then if there is something like this that you were dealing dealing with, growing up. You wonder what their quality of life's going to be. You wonder what their everything is, how is it going to turn out for them? Are they going to be able to have this? Are they going to be able to have that? Will they experience this? Will they experience that? And then here comes this man.
Yeah.
Gave it and allow this space for all of that to happen.
And he did. And she was in the hospital in Valley when we lived in Maple Valley, Washington. And I remember it was the first time Chris said, I'm going to stay with her overnight. And it was the first time I could ever leave and go home and feel safe.
I just teared up for you.
We all are. It's true.
I believe that. Look, I watched my daughter go through that, and she struggles with who can I need that space for myself.
Yeah.
But how do I walk away? And is it going to be okay? And that constant worry, right? And
yep.
I've been one of those safe places for my grandson. For her, she feels safer. And even though she feels safe with me, it's still, I'm getting phone calls, text messages, is everything okay?
Right.
Hey, right. More than your normal, just leaving your child behind. It's the condition. It's that little bit of fear that plays out in the back of your mind, and it doesn't go away.
Exactly. And it doesn't, and it never will.
It never will. No. So,
she's staring at me.
I know. Let me talk with Chris and Jess a minute.
Absolutely.
Get myself Your mama made me cry.
No.
So Chris, you shared a couple of things with me, and that's the reason I said the things that I did, and I just knew that your mother-in-law was going to feel that way, because when you have a daughter, you want them to be able to grow up, and you want them to find that person in their life. I'm going to sit here and cry more. They'll find that person in their life that can fill the other side for them, and who has the life skills and the mindset and the ability to genuinely love, care, support that union that you two seem to have. I mean, a lot of men, we'll just be honest, a lot of men would have been scared off by that news, by that information. And I think, Jessica, we know that as women, when we have something. And you didn't. Not only did you not, you went, okay, I have to make these decisions now because I have this woman to take care of. You went and joined the military.
Right.
For her to be able to have the security.
Yeah. At the time, we didn't have any real options. I mean, we were just starting out, just got married. We were in the restaurant industry, and we knew that she's going to need, some way to be taken care of. And we were talking about it and decided military was a good option. They have that good healthcare insurance, and let's go for that. So we got married, and I went right into basic training. I did my technical training, and then at my first base, she met me there, and we got our first house on base housing together, and that's kind of where we started our married journey.
Well, I think it's absolutely beautiful.
It gave him a great career that translated into the civilian world nicely.
Mm-hmm.
Thank goodness.
Yes. And Victoria's right. You have that foresight. You definitely approach life with that foresight. So it's just beautiful. I just wanted to know how much it's appreciated and seen. I mean, even from the outside in this short period of time. So
we tried to make a plan, and so far it's worked out well. So
amazing.
Yeah.
So Jessica, here you are, long way from home in Vanderbilt, but thank God your mom was only an hour and a half away.
So nicely.
I don't think it would have mattered where you were,
No, she would have been
that too.
Every time I've been hospitalized the past year, she's been there.
Yeah, I believe that. You have an amazing support system.
I couldn't ask for anything better, honestly.
So Chris says that he's the one who thinks on the more positive side, the half glass full. And you tend to think on the more negative side, the half glass empty. Do you struggle with that side of things?
I think it's because I tend to look at things from every possible scenario, and even things that couldn't possibly happen. And yeah, I do. Yeah, he's good at bringing me back. Wonder where he gets that anxiety from.
I mean, it has to be scary. I know. I mean, I had a spinal fusion. I'm talking, and I was scared. I was at Vanderbilt, and I had it done at Vanderbilt. So I was in a different wing in that hospital, but I was right there in that hospital. And it was scary. Those what ifs what if something happens? What if I can't walk? What if all of this what ifs do play in your mind. So are you struggling with any of that, Jessica?
No, I'm actually looking forward to the surgery at this point. I've been so sick the past 2 months that if you let me sleep, I'll sleep for 24 hours. I won't get up to go to the bathroom. I won't get up to drink. I won't get up to eat. I can't, like I was explaining to you earlier, I can't take the kids places. I can't really do anything. I can sit there and watch movies with them. That's it.
Yeah. So your quality of life is not there, not where
no, I want to get my life back, and I want to get back to doing what I'm doing.
You're a fighter.
I have actually found a wonderful therapist.
Good.
Who is a former single ventricle. She has had her heart transplant herself.
Amazing.
And she had it when she was in her 20s, and she's a year older than me, and she's still kicking. So
I've said, and I've got a website and a community and stuff, and I say often that it's a different world, it's a different lifestyle, and it's because it's there, and it's kind of that lingering thing that's there, and it does. And Victoria can say this, that it confirm this, that it's always there. It's always in the back of your mind. You still try to go forward with that normal lifestyle and everything else, but that's still that one little thing, just like her having to take those days off during the week for the repetitive appointments and things like that. So having someone who knows, who's walked that path, that is your therapist, that is the most invaluable thing you could get your hands on.
She is pretty awesome.
Yeah, because I'm on the outside looking in. I've watched my grandson go into his spontan surgery. I didn't get to be there for a lot of it because of COVID. I got to be in the hospital when he went into cardiac arrest, and we didn't know if he'd make it at 2 months old. But then only for the Fontaine, so I was there for that. And it's changed my life. It's the reason I'm doing what I'm doing. Watching my daughter go through this and my grandson go through this, and her trying to be as normal as can be. So I commend you guys for the steps you've taken. I mean, that you've reached out and gotten the counseling. That's awesome.
Yeah, she's a great resource. Yeah, someone who knows what it's like to go through all this, and just asked a ton of questions and helped get mentally prepared for this. Yeah.
And hers was an emergency too, so she can survive an emergency that didn't even know it was going to happen. I can survive a well thought out, planned one, I figure.
Was there one thing in particular that helped shift your perspective? Fear to motivation, or anything that you could give as advice?
No, just the fact that I think just the sicker I get, the more that I want it, because I just can't take it anymore. I'm so tired. I'm so out of it. I don't really want to do anything anymore, and that's what's scary.
I think the drive to be there to see the kids grow up and graduate and get married is really strong for her also.
Yes, I want to see my kids. I would hate leaving them right now, and I think that's more scary than the surgery. And Vanderbilt, from the research we've done, seems to be like the McDonald's of surgeries for Fontans. They just keep going and going and going. Whereas in Houston, my hospital, they do a fair amount, but they had just gotten a new surgeon who's only done 4 or 5 actual congenital patients instead of just normal heart.
Like Fontan, congenital,
That's a big difference.
Yeah.
The anatomy is different, and the effects on the body over long term is different. So that's,
Texas Children's is there, and that's a good hospital, and they do tons of surgeries on CHD, but children. They've only done 2 people over 40.
Yeah. Oh, 2?
Yes. So...
Yeah, they had just opened their adult program. So we were looking at all the options, and we think, well, Vanderbilt, they have the most experience, the fastest turnaround. Yeah.
And our home hospital also told us to check out Vanderbilt because it has a 20-day wait average, as opposed to them is over a year. But we're like, all right. And my mom lives in Tennessee, so it's I think it's probably more convenient for you too.
Oh, yeah.
So
you're flying back and forth right now, Chris?
Yes.
And you come in every other weekend? Is that what you do?
That's the plan for now, yeah.
Jessica, did you say you had COVID?
Yes.
That's what I thought.
Not right now, it's gone, but they found it incidentally at the other hospital I was at right before I transferred over here.
January 3rd, just about.
I remember, I just clicked. I remember that. So did you have to fly out? Did they transport you by air?
Yeah, they called me New Year's Eve to tell me I've been accepted into their program.
Vanderbilt did.
Yeah. And they asked how I was doing, and I told them all my symptoms, and they're like, you need to be medevaced out here, like, tonight. So,
Oh, I bet that was a surprise moment.
Yeah.
Oh, yeah.
Because I was making New Year's dinner. We were going to go to a friend's house for New Year's. And I was in the middle of cooking
I'm going to celebrate New Year's, and you want me to medevac?
Yeah. So that's where I'm guessing I picked it up, because we were in the... They said go to the hospital and they'll medevac you out up to us. So we went, but here did not end up having a room for like 4 days. So we stayed there in the ER for almost a whole night.
Yeah, I stayed in Houston Methodist for a few days.
Probably got it at the ER
there.
And one night they just shoved something up my nose. I had no symptoms. And they're like, you have COVID. You have to stay in the room now. Thanks.
Oh,
she was asymptomatic, but it just happened and she caught it. So
yeah.
So
you fly back home today. Is that right, Chris?
In about an hour. Yeah.
Okay. All right. I'm going to go back to see the babies.
I'm excited to see them. That is true. Yep.
Yeah. It went too fast.
So, I know that we were talking earlier about them wanting to come out and see you guys.
They want to visit real bad, but just with the uncertainty of what may happen or when the surgery could happen, it's hard to plan a trip to get the kids out here to see her. Yes. But in the meantime, at least every day we have, FaceTime, and they can call her and we can make sure that the kids see her every single day.
Yeah.
Yeah.
So, I mean, it's not as good as being there in person, but with all the uncertainty, surgery could happen next week or in a few weeks. We just don't know. Or in a couple months. We don't know.
Is there anything that you would like to share, Jessica, to other heart warriors out there who are younger about this possible stage coming in their life?
Enjoy what time of healthiness that you have when you have it. It's fleeting, but it's there. Make sure to take care of your health anxiety that you have, so you can enjoy your time and just know your body and know yourself, so things don't get out of control. Because a lot of doctors, institutions, physicians, urgent cares will have no idea what to do with you when you come in and say you're sick. Especially if you go to the ER, they'll be like, okay. So just make sure you know your stuff and who to call and what to do.
Do you feel like your mom prepared you from teenage years up to start working into your own advocacy and awareness towards yourself?
Oh, absolutely. Oh, yeah. She lets me do a lot of the talking, but I forget stuff.
Yeah.
Now he does a lot of the talking.
So in those years of transition from teenage into adulthood, do you recommend that the parents stay involved for a period of time? Person, of course, depending on the people, of course, but
depending on the people, I like when my parents or my spouse goes with me to all my heart appointments. Every other appointment I go to is just for me, which is fine. I can handle all that, but I do appreciate someone being with me, because my 2020 surgery, when I was told I needed that was like the one appointment I went to by myself.
Oh, really? And it was the one time.
It was a lot of sinking in, and then basically everyone, once I heard what was happening, everything sounded like, the Charlie Brown adults talking to you. Yes, but
our brains are amazing how they try to protect us.
And especially if something so important, it's also good to have an advocate with you, because some doctors aren't as great as other doctors, unfortunately.
I agree.
Some doctors won't listen to you no matter what you say.
And she runs into a problem, just to tell you, because she looks good on the outside. It's the inside, and people can't see that. They'll bring her in. Oh, she looks fine. There's nothing wrong with her. And right. It's like they don't have a clue, because she looks, so good.
I've even gotten that from cardiologists before.
Wait, I mean,
I've been sitting in the hospital waiting for transplant. Oh, you look fine.
And you do look good. I will admit, when you came on the camera, I was a little surprised. It's not what I was expecting.
Oh, thank you. I'll take it, but
yes.
Yeah, I don't feel great though.
Exactly. Yeah, but that, I'm sure you're exhausted. You just want to take a nap.
Yes.
Yeah. Well, guys, I want to thank you, Chris. I don't want to stretch your time. I know we pushed it a little hard for you on that. I apologize, but I thank you. I thank you too. Is there a way we could do a follow-up?
Sure.
I would love to do a follow-up after your surgery.
Oh, absolutely. I'll email you once I know when it is. It's
Please.
Coin toss at this point. We don't know.
Yes. Yep. But please let us know. Keep us updated. We care. We absolutely care, and I want to know.
All right.
Hey, guys,
I hope your granddad's good too.
Oh yeah, he's doing really well. He just had a cath because his pressures were a little high, and they did do a shunt. So they did the coil. They did the coils.
Oh, I get it to get the extra vessels off.
Yep. Yeah, he had 2, and those spontaneous vessels. That just amazes me.
Yeah.
I mean, why does our body decide, hey, we'll put a vessel over here? I mean,
it wants more. It wants to breathe more, so it's trying to grow more things.
It's just
how I got explained it to me.
Oh yeah.
Yeah, it just amazes me how our bodies do.
Yeah,
it's crazy. So they fixed that, and he was a champ. He did fantastic.
Children are very resilient, and hopefully things will slow down for them soon and become more normal. Stable. That's the word.
Yes, stable is the norm. That's correct. But the one thing he likes, because between Knoxville and Nashville, is there's a Buc-ee's.
Buc-ee's are great.
Yes. I seen my first one.
Oh, did you like it?
When we were going to Michigan, yes.
So that's his thing. It's like, okay, you have to go to the hospital for an appointment. Oh, do I get to go to Buc-ee's? Yes, we have to go to Buc-ee's.
Oh, it's like a treat.
I'm in. Let's go.
Yeah, right on.
Well, listen. Thank you guys very much. I really appreciate your time. We're with you all in spirit and lifting you all up. Okay. And Victoria.
Thank you.
Thank you. Thank you so much. It was so nice to talk with you.
You as well. And Victoria, I'm lifting you up too, Mama.
Thank you.
Big hugs. Big hugs. All right. Goodbye. We'll talk soon.
Sounds good. All righty. Bye-bye.
Bye-bye.